Yeah.
All right, so we are live now, and thanks everyone for joining. This is the F&M show on Social Samosa. Glad to see you all back on a wonderful Wednesday evening. It is back here in Bangalore. We are at say about 20 degrees in Bangalore, so just a little chilling there. Again, thanks for joining. And today we have a wonderful guest on the show, Dr. Vikram. He is a healthcare professional and a digital expert. Uh, by career, he was a dental surgeon, or he is a dental surgeon. I will ask him to elaborate his current role and his experience. Uh, Meanwhile, over to you, Falguni. You want to share? You want to start off? Sorry.
Yeah. So thanks, Malhar. Welcome everybody on the F&M show. And as Malhar said about the Bangalore weather, Ahmedabad equally has a beautiful weather. So welcome to a beautiful Wednesday evening. We are on the F&M show on Social Samosa. And we are today very happy to welcome our guest, Dr. Vikram, whose Twitter bio I was just reading, and there are such interesting keywords there. So I see a problem solver, I see a doctor by profession, I see a growth hacker, I see a digital evangelist. So we are very happy, and I look forward to the interaction today. And over to you, Dr. Vikram, if you want to tell us a little bit about yourself.
Yeah, sure. Thanks, Falguni, and thanks, Malhar. And great to be here on a Wednesday evening, which is it was actually a very beautiful day in Bangalore today. Not very hot and bright and sunny as well. So I started my career as a dentist, like Malhar pointed out. I ran a chain of clinics in Delhi. Moved on to management from there, Falguni, which is absolutely in your area as well as this area right now. I specialized in marketing, moved on to technology. I worked extensively around healthcare systems, both in the US, Europe, as well as India. And currently my focus essentially remains as an evangelist for the healthcare industry in India, especially looking at trends, adoption of digital, working with startups. It's a very exciting place to be. And I'm really excited to talk about digital any time of the day, morning, afternoon, evening. So
awesome.
Digital healthcare is absolutely the right place for me. So happy to be here.
So that's really nice. Yeah, Malhar.
Super. For folks who are there on YouTube, we are also trying a dual cast on Facebook. So the moment you saw me turning left, I was trying to set up things. Thanks, Vikram, thanks for joining to start off with. And I know we have been connected for a long time over Twitter and other platforms, and I have been always excited to hear your insights on all the things happening in digital. So to start off with, say probably how was it moved, or how have you say balance yourself as a healthcare professional and a digital professional, or a management professional, as you put it?
Yeah, it's providing dental services back in Delhi. My area of focus was very specific, to providing the dental care, and it was specific to my clinics or to the ecosystem of dental professionals in and around Delhi. The change I had to make significantly as I moved from being a dental professional to becoming a management professional working in healthcare was I had to look at the whole healthcare ecosystem. And when you try looking at the ecosystem, it's a much wider universe than just a set of clinics or just a set of hospitals, right? A healthcare ecosystem in India specifically centers a lot around the patient, but has very key players like the government. The government is a very big player in the healthcare industry globally because it's a highly regulated industry. There are obviously the large hospitals which provide care, both some run by government, and a lot of private institutions in India have really come up, including those funded by foreign entities because of the relaxation of norms of how foreign entities can get involved in healthcare in India. There are obviously a lot of medical device companies that have been in India for years. A good example is Philips Healthcare. They've been in India for years, and they've been reverse innovating. They've been innovating in India as well. That's an important constituent. There are the pharmaceutical companies, which obviously play an important role in keeping us healthy, giving us our daily dose of pills. And then there is the startup ecosystem, which is working effectively. There are insurance players. And not to forget, binding all this is technology, is digital, it's processes. So it's a much wider ecosystem than what I was used to. And trying to understand the ecosystem and the role that influence play in it and how to manage that complexity is the change I had to make.
Super. Falguni?
Yeah. So I was thinking through that since you've seen the life from both sides as a healthcare practitioner and now looking at the digital of healthcare, do you feel healthcare as an industry has been very late as far as adopting digital is concerned, or is it an outsider's perspective? Like, is it just our perception that we feel that digital was a late adopter, according to you?
Yeah, I mean, that is a very, that is correct in many ways and not so correct in so many ways, because it's always considered that healthcare is a laggard. But when we talk about healthcare, that is a very context. We see that healthcare is predominantly hospital, and 70% of healthcare in India is essentially hospitals and the care provided by hospitals. And over the last 5 to 10 years, a lot of healthcare professionals, digital experts, technology experts have gravitated towards healthcare. So from being an industry that was not seemingly adopting healthcare, today I think healthcare in India is advanced in many, many ways, right? And they have been adopting healthcare, digital and technology at a much faster rate than a lot of the other industries. The projected rate of growth for healthcare in India is somewhere between 25 to 30% CAGR, right? Depending on whose numbers you take. But Ministry of Health says it will grow 25% plus. And a lot of this is fueled by the adoption of digital and adoption of technology. Some great stories are there in India today where we have seen that hospitals, large hospitals, even mid-sized hospitals adopt digital and give a great patient experience, solve very complex problems. And at the same time, a lot more needs to be done. And we can look at it as a glass half full and half empty, but I'm supremely optimistic that if you see great innovation in the space of digital and technology in India, it will be in the healthcare space in the coming days.
Okay. Yeah, Malhar.
Sorry, we lost you for a bit, or was that my connection?
No, Malhar, we can see you and hear you. Yeah.
All right, so that's my connection. But
carry on. Yeah.
So, since you brought out the digital aspect in healthcare, so I would like to go a little deeper in terms of the trends. So, what are the key trends in healthcare that is influencing the growth of this industry?
Yeah, absolutely. So, I would like to classify into 5 or 6 major trends that I'm seeing that will push healthcare to the next level in India. See, firstly, I think in India, we are in a unique position to build a healthcare model unlike anybody else, right? The other country that's in this position is China. And in China, they have kind of evolved into a system where they are trying to balance out the latest in Western education, Western technology, Western ideas, and with their traditional medicine. That's what they're doing. Now, in India, I think we have an opportunity to create a similar system, right? So if you take Government of India numbers for the number of doctors per person, it stands at 7 per 1,000 or something like that, 996,000 registered allopathic doctors in India. But if you add the number of Ayush practitioners in India, which includes homeopathy, Ayurveda, etc., there is a significant number being added, 700, 800,000 plus, and add to that 154,000 odd dentists, right? And these numbers vary. I mean, I might be off by a few thousands here and there, but that increases our doctor-patient ratio significantly. So I think one major opportunity or trend we have is to create that integrated system of care, right? Where we get all sorts of all practices of medicine. People talk about diabetes being a modern age disease, right? We were potentially we were a hotbed for malaria. We were a hotbed for a lot of those illnesses, which were more infective. And now we have switched over to more chronic diseases, lifestyle diseases like diabetes, right? That's a common perception.
Progressive, yeah.
But in about 800 BC, Charaka wrote about diabetes. And he had a cure for it. He had classified diabetes into acquired, genetically acquired, and those we take it because of our habits. And he had also listed down the habits that cause diabetes. So there is a lot of work that has already been done in India in the past, which we obviously have no access to and which we tend to discount at times. So I think one big trend would be integrating these two systems and making sure that, I'm not saying that we throw allopathy overboard or we adopt Ayurveda completely.
Right.
But I would see a very complex hybrid of these two systems coming in and working together to ensure that we get healthier. So that's, I think, one big trend. The second big trend, which impacts digital directly, is that patients would be given tools and processes and apps and all the lovely things to take care of their health themselves, right? Digital will not only provide them information on what is there, they will be also open to diagnosis, self-diagnosis, and also given advice, all through digital. And that is the future. You can't help it. I mean, today, if I have to reboot my PC or if I have to choose which antivirus to use or which AC to buy, I definitely go online and search for the different choices. I take quotes and then I probably go and make up my decision.
Correct.
I think it's going to be no different. Because at the end of the day, it deals with people. If people are used to a certain way of life in one sphere of their life, they will continue to, adopt those best practices into other spheres. And we will see that happening in healthcare as well. I think the third important trend that I see is that hospitals will morph. Hospitals will morph as centers that provide critical care, emergency services, and maybe chronic care. But a lot of the routine checkups would be delivered through digital again. So home health is very important. We've seen the growth of telemedicine, and some people say it succeeded, some people say it failed. But home health is different. It'll be like me sitting at home using high internet capability bandwidth on a smartphone, just talking to my doctor and probably not visiting him. Because today, a lot of physician time is wasted, or I'll say incorrectly consumed by checkups, by follow-ups. He may not need to call the patient in if he can consult him over phone, and things are happening. But in the middle of all this, you might ask me, what happened to security? What happened to privacy? Who's going to ensure that your data is not stolen, your data is not improperly used? So I think the fourth trend is we have already seen actually the government putting in a lot of standards in place. I was recently at a couple of healthcare events where one of the advisors to the Ministry of Health and Family Welfare said, we are in a unique position in this country because in our country, the solutions came later, the standards came first. In most countries, the solutions were already there, and then people regulate it. Let's standardize stuff. This is not the way to do it. I mean, whether it's HIPAA or HL7 or all the wonderful things that we in the West and in the Western Europe and the US. But in India, we'll have the standards first. So the EMR standards are already there. The government has already specified them. The EHR standards are already there. The government has specified them. There's a portal, National Health Portal. You can find all standards available there. And the government of India is very clear, and through initiatives like digital health and through the schemes run by the Ministry of Health and Family Welfare, that this is how you're supposed to run it. These are the standards we prescribe. Not only that, I think the government is doing a lot of work in promoting digital adoption by hospitals. A good example is the Rashtriya Swasthya Bima Yojana. Right? 100,000 family available, and it's supposed to be totally cashless. And obviously, let me not rub it in. There's no money in it.
Wrong moment.
I'm sorry. It came. I mean, these things are not connected, but now they are. Now they are, right? And now there's no money. There's no cash. So that means you have to put on an EMR in order to receive financial aid, and that can alter, like he said, significantly alter the balance sheet of a hospital, right? If 100,000 rupees is available per family. It's 100,000 per family and 130,000 per family if you have a senior citizen. There are a lot of other schemes. And finally, I continue to believe in the power of startups. The rate at which startups have grown, innovated in this country, I think it's a big thing. Startups are going to need innovation. Hospitals are going to continue to be a source of best practices, learning, expertise. But when it comes to innovation, it will be startups that are leading. Whether it's a very very established startup like Practo, which is probably a household name today, to up and coming startups which are coming up every day in Bangalore and in places like Delhi and places like Ahmedabad and places like Pune. I think these guys will rule the ecosystem as far as innovation is concerned. So I see these 5 clear trends emerging in the country today as far as it is.
So in fact, from the startups that you talked about, like I also know Practo, I know Fitbit, I know some apps which will give you like calorie diet and your food count and all, step count and all. So being an expert in this field, which are the 3 startups which you see a huge potential in, which will survive through the digital, wave? Like Practo, of course, is an established one, but if you can tell us some new startups, top 3, according to you, close to your heart.
So I want to say first, give a disclaimer that I have no stake in any startup.
Yeah.
That I'm going to mention. Okay? It's not promotion. These are the startups I've seen making a clear difference. So the number 1 on my list has to be Librate. Saurabh's team sitting out of Delhi, Librate. It is probably one of the best sources for information. If you really wanted to search on various diseases, you wanted to understand, get more education, if you wanted to consult a doctor, qualified physician, I think Librate is a great example. The team they have employed advanced technologies, they have machine learning, they give you contextual offers based on your past experience, of what you've been searching for, what you've been asking. That's phenomenal. So definitely check it out if you haven't as yet.
I haven't, I'll check it out, yeah.
The other one, which you actually inadvertently mentioned, is the calorie counter. So I talk about tools that digital is going to give you to maintain your health. I think one of the areas is definitely nutrition, directly linked to healthcare, whether you like it or not. And Tushar Vashisht and his team at Healthify Me is doing a great job. I've been watching them grow for a while now. Not only did they participate and go into NIN, that is the Department of Nutrition, a National Nutrition Institute, and they went in to classify a lot of Indian food items by calories, because I believe it is one of the largest big data projects of its kind in India, where they maintained and converted paper records into digital records. Now, if you search on Me, you can find probably any food item available, which is not there in some of the Western apps.
Yeah.
And they have expanded it to providing a health coach, yoga coach, nutrition coach. They've added calorie counting through Google Fit and etc. I think it's a phenomenal example of the power of digital and what one can do if you really put your heart and soul to it. Right? Understand.
This I'm aware of, because our Gujarati Khaman Dokla is also included there in the calorie count.
I was so amazed with it because I'm a Tamilian, I'm of Tamil origin, and we have a lot of delicacies on our side, and they have it all.
Yeah.
So they've done a phenomenal job. The third one is I wouldn't consider them a startup, but they're in a very unique space. This is Cloud9, who provide a lot of maternity services. They are a birthing facility in and around Bangalore, and the amount of the kind of customer experience, patient experience they bring in, taking in digital, taking in a lot of machine learning, again, is phenomenal. They have preset algorithms. They work a lot in this space. I think we will see. You need a different mentality to run a maternity center as opposed to running a large hospital. And one of the things I like about them is they treat maternity as a celebration. So it's almost like somebody is having a large celebration, and the whole hospital, the whole setup is structured around celebration, which is very different from a traditional hospital, which is much more serious, right? You don't want to be very happy in a hospital. But
yeah.
this is probably one of the few areas where where you have you have a different kind of feeling. So I think these three are great examples, but by far there's so many others. There's so many others that I can
I'm
talk about.
sure.
But these three stick out. I think they will survive and they will go on and they will be household names very soon.
Yeah, Malhar.
Super. I have one question from the audience. So this comes from Facebook Live, which I think Gatia has put in. Uh, how do you see access to good healthcare be ensured to villages via digital? Do you think lack of internet is affecting it right now?
Yeah, absolutely. See, currently, let me talk about one project where digital, in a very rudimentary form, Malhar. When I talk about digital and Falguni, digital, we always think about high tech bandwidth,
Yes.
time and what we're doing right now. But there was a project run by the Gujarat state government, which is called eMamta. I think Falguni, you might be aware of it.
Yeah, eMamta, yeah.
Then, health workers went on foot using basic cell phone, collected maternity data of expecting mothers and newborn babies. And this was, typed in English, but in vernacular, in Gujarati, right? And it was, the messages were sent back to the regional center in Ahmedabad, from where, these huge reports were created and alerts were created. The alerts were created to ensure that the patient and the mother don't miss the next vaccine, don't miss the next shot. Right? And that has really helped in reduce infant mortality in Gujarat, right? The eMamta model is a success. Not only that, I think 9 or 10 states in India in 2004 started probably one of the earliest disease surveillance programs. Again, it was very paper-based, but it was collected regularly and alerts were sent to the head office in Delhi, and alerts used to be sent out to these states if they saw a disease pattern emerging.
Yeah.
I feel we need to further explore the use of infrastructure in these towns and villages. Right? I'm not saying that we already have everything we need. With digital India, I see a lot of that changing. I see a lot of infrastructure being built up. Right? It's different in different states. So access to healthcare, yes. Once you have more bandwidth, more infrastructure in the villages, it will increase. But access has already started coming in, right? The other good example I want to give is tele-ICUs. So nowadays, there are organizations like Next, which are these ICUs, which are monitored from city, just like how you have a knock, Malhar, where you monitor all the service tickets through a knock. You don't need to be at the center. You can observe it by remote. It's a similar situation. Lack of infrastructure is still impeding them, but people like organizations like Next have already started implementing them, where they monitor an ICU from a remote location like Bangalore. They can monitor any patient from far away, and obviously ensure that intervention is done at the right time. And this is one of the reasons why we have so few intensivists. ICU is being monitored by an intensivist, and there are very few intensivists in India. There is no other way but to have these remote systems. So these are evolving. I think a lot more needs to be done. But that is the only way forward.
So I feel infrastructure at two levels needs to improve. One is at the level of healthcare industry in itself, like you are talking about those specialist doctors, the reach given by medical, and on the other hand, it is the digital bandwidth that you talked about. So I think two major areas which need to grow on its own. Yeah.
I think, as far as creating doctors is concerned, I think most of us are in agreement that cannot happen. That is a process. When we try to accelerate creation of doctors, it somehow backfires, because there is a process to it, right? Now there are organizations, for example, I had a very interesting discussion with Dr. Lalit Singh, who's a part of Elsewhere, and they are creating these tools, digital tools, by which medical education can be improved, right? Can be optimized, right? Because each student has its own pace of learning, right? And it can optimize, provide simulation, so that by the time the medical student enters third year, enters clinical part of the course, he is more equipped to deal with it, right? So we can increase efficiency, but unfortunately, in a country like India, where quality is of paramount importance and should be, we may not be able to increase the output. So the only way we can do it is to make sure that more patients are being able to be monitored by fewer doctors. For that, we need digital. There is no other option for us.
Of course, of
This
course.
size, it would be almost impossible.
Super. Falguni, you have to pick up the last question. I guess we are almost over there.
We are almost on the last of this thing, but I was just wondering, I was thinking through when you were speaking about how rural it is going to go and digital divide is going to break, how it is going to be an equalizer. So digital is going to make healthcare, the urban rural divide will somewhere diminish if digital is used rightly. So maybe off the brand marketing question, that do you see this as a huge CSR opportunity for brands to tie up with healthcare industry using digital?
I have a different perspective on it. I mean, the charity has to come from the individual. See, as individuals, we have to get more serious about our health.
Of
And
course, yeah.
sometimes I think charity begins at home. And if each individual, whether it's in a town, village, or in a city, is monitoring his health, focusing on prevention, understanding all this data that's available to him, consulting with doctors regularly, I think we can heavily reduce the incidence of intervention and admission.
Of
I think
course, yeah.
that has to be number one. As far as brands are concerned, I think a lot of
Already doing it. Yeah.
Did we lost losing?
We did lose him, yeah.
Can we get drop your audio and video? Wait for a moment. I have one question from Nitin as well. Who's on Facebook Live.
Yeah, we'll wait for a minute. Yeah.
Yeah. Then there is Ramya on.
Then there is Ramya on. Okay.
Okay, Falguni, your audio was on. You're walking on.
Yeah, I've switched it off.
Okay, I guess we lost him. Trying to see if we get joining again. Vikram, okay, Vikram is trying to join in again, so we just exit you. Guys, let us wait for a moment and see if Vikram can join in. Okay, question is there. Ramya, okay, Ramya had put some nice comments on YouTube, so you want to pick up Falguni? Or I'll pick it up, no problem.
Yeah, yeah, it's for me the audio will go.
Right. So Ramya has made a couple of points. NH has tied up with Cisco and HP for reach in rural areas, especially Karnataka, UP, and Jaipur. So that is some
Right.
information that is coming from that.
Because I think the point he was making when we lost him was that already quite a few brands have started doing this. So they are using the digital. Yeah, he's back.
Yeah, we were just talking about infrastructure, and I think
Yes.
not very good. And it takes about 30 seconds for the generator to kick in, but that is unbelievable in a hospital setup, So the last point I'll just make very quickly. I know we are out of time. Is that there's an absolutely tremendous opportunity. Good example is how Reliance, how Tata have invested in the healthcare space. I think Reliance, as well Reliance or the Anil Ambani's group has also invested in the Kokilaben Hospital, which is doing some tremendous work in oncology in the state of Maharashtra. Those are good examples.
Right.
And I think, overall organizations that are well entrenched in the Tier 2s and the rural areas, especially a lot of the FMCG brands, can help with the lifestyle connectivity. I think that is very, very important. And whatever they do in that space, because of their already existing presence and their understanding of that ecosystem, will be very fruitful for the healthcare systems to evolve in those areas. Tremendous opportunity.
Right.
So Vikram, I had one question for the audience which has come in. So Nitin, in continuation with his earlier question, is asking, do you see SMS reminders to take medicines, saving lives? Yeah, it's form of
Absolutely.
digital.
I mean, just look at the amount of patients who are getting into trouble because not following a medical protocol. So
Yeah.
I had a discussion a few days ago with Dr. Akhil Sangal. He's from the quality control in healthcare, and he says the number of we focus a lot of our attention on medical fraud and things like that, but that's hardly anything as compared to the number of errors we have in medication and non-compliance of treatment. I think
Mm.
SMS reminders is a brilliant way example of a low tech, low tech in our parlance,
Yeah.
solve a very complicated problem. Especially in chronic cases like hypertension and diabetes, I think they will work wonders. But again, I would rather have it prescribed through an existing medical center than self-medicating using SMS service. So yes, absolutely, it's a must.
So super. So we are just little over half an hour on the show, but nonetheless, thanks Vikram for joining. Again, as I said, it was wonderful to have you on the show, talking about a topic which is way beyond our imagination. To link it back to digital and how the government as well as people like you envisage that healthcare will improve in India based on all the disruptions happening in digital. Thanks for joining. Falguni, any final words?
Yeah, in fact, I second what Malhar is saying. Digital is something which we know little of, but healthcare is something which we don't know at all. So linking the two was just wonderful. It was really, really nice listening to you, especially my favorite bit from the entire dialogue was the trends that you captured, the key trends that you captured for the road ahead. And maybe one of the conscious bit was how we have to be self-conscious about our own health. That also I'm taking it as a key takeaway from the session. Thank you so much for joining us.
All right. Thank you, Falguni. Thank you, Madhar. Great being here.
Yeah. Last thing, Vikram. Where can people know more about you and follow you or connect with you?
Oh, excellent. Thank you, Madhar, for that plugin. I'm pretty active on Twitter, like Madhar said. My Twitter handle is at Dr. Vikram. Also, I am part of a blog. I founded a blog some time ago. It's called healthcare-in-india.net. We try to be independent. We don't try to swing towards any particular brand or particular format for medicine, but we try to report as is. We do talk to a lot of influencers in healthcare, and you can get the latest updates in healthcare from there. And apart from that, Healthcare in India has a Facebook page. If you can follow it, and you can get the regular updates. If you want to contribute, participate, we are more than happy, because I think healthcare is an ecosystem play, and we are all part of the ecosystem, whether we like it or not.
Thank you. Thanks, Vikram.
Thank you
And
so much.
for folks on Facebook Live, thank you so much. I know there could be some technical challenges I'm not tuned into yet, so I'll just look at what we have done. Thanks, Vikram, and good night to you, and have a lovely rest of the week ahead.
All right. Good night, folks.
Thanks,
Bye.
Good night. Bye. Thank you.
Audience, thank you.